What's up, YouTube? In today's video, we're going to be talking about if type 2 diabetes can be reversed without surgery. Now, in this video, we're not going to be talking about my own thoughts, my own feelings, or anything like that, but rather there's a study that can answer this very, very plainly. We're going to be going throughout the study and seeing what happened, what methods were used, how do they do it, what was involved in the study, and see if it can be applicable to those who are suffering with type 2 diabetes right now. I know that this is a disease that's actually coming up even now in children in today's day and age because of the different types of methodologies that we are using in everyday life. So we can use a study to see what kind of exercises, what kind of things we can implement into our lives to actually reverse type 2 diabetes. We're going to find out in this video. Stay tuned. Now, when it comes to the study that we're going to be looking at, there was two main approaches that were used to fight against type 2 diabetes. The first one was a non-drug approach, just meaning that they're going to be changing their diet, lifestyle, exercise routine. This is the one way that they were aiming to reverse type 2 diabetes. But in the other way, the other method was actually lifestyle changes as well as taking medicine, like metformin, insulin, and things of these natures as well. So which one is going to yield the best results is what we're going to be finding out. Biggest takeaway that was found actually in this study was that type 2 diabetes can actually be reversed and it can go into remission actually. But even though both groups saw a remission in type 2 diabetes, the group that did the lifestyle only, rather than the group that did not do lifestyle only, the lifestyle only saw a 5 times more likely increase of remission in type 2 diabetes versus the one that did that lifestyle and drugs. This is very significant because a lot of times it's marketed that you need the drugs and medicine to reverse type 2 diabetes. While those things can help, according to the study, those who only did the lifestyle the lifestyle changes, like the exercise changes, the diet improvements, the coaching, and things of this nature, that's the group that saw the biggest change rather than the one that did the medicine as well as the lifestyle. So what happened? Why is this? Now, here's what they found using both approaches. Weight loss is the major driver, not just any weight loss, but fat loss is the major driver. The more the people lost the weight or more fat they lost, the more likely they were to lose the type 2 diabetes that were going to reverse. But the main thing here is that the approaches were very, very strict and very, very intense. Those who saw the biggest changes had 3 things. They had exercise, they had check-ins, and then they also had support. By constantly checking on the people that were on this track of reversing type 2 diabetes, and by always making sure that they're exercising as well as pushing them to exercise using support from friends and family and just things around the people that are on this journey, the more likely they were to reverse type 2 diabetes. Proving that even just by having a coach or someone help you along the way, giving you the nice professional help, whether you use medicine or not, is going to be helping. Now, of course, with this lab or within this experiment, those who did not use medicine, they did see more powerful results compared to those that did not see or use medicine as well. But the main thing was the support, the exercise, and the coaching as well. Now, along with what was just previously mentioned, the number one thing actually in regards to what was that main trigger was actually the fat loss, the weight loss. If there was no weight loss, but everything else remained the same as if they were eating the still unhealthy foods, or if they were not changing, or if they were still exercising, but there was no calorie deficit that required them to lose any fat, then unfortunately, the results might have been different. But because there was so much weight loss within all of the studies, this was the driving factor, the driving force that was seen in making sure that these people were reversing type 2 diabetes. Yes, the coaching was good, the check-ins were good, the support was good, but without the actual fat loss that came from the diet restrictions as well as the exercise, then no changes would have happened. Now, by having them on a diet that's restrictive and that's very, very strict, as well as them working out and then checking their progress over and over and over, what they saw was that their A1C went down, their insulin sensitivity went up, and because their blood sugar went down, A1C went down, and their insulin sensitivity went up, they're now going back into a more normal state for the human body, which is bringing them closer to the remission of type 2 diabetes. But here's the catch. As you can imagine, if you're on a structured program that's very, very strict, where you're always monitored by professionals, where you're always checked in by friends and family, where you're always checked in by your coach, and where you're always on a strict diet as well as the exercise, as you can imagine, once that type 2 diabetes is gone, the desire to keep training at that level and to keep that discipline that was gained during that time, it can actually fade. That discipline can actually fade over time, which is why those who have type 2 diabetes, once they get it, they actually go back into it, because those habits that they formed that led them to get type 2 diabetes in the first place is now coming back, which is now making them gain the weight again, making them not exercise as much, making them not track the food that they're eating, making them not getting checked in as much as well, which leads to them going back into type 2 diabetes. It's not the fact that type 2 diabetes is a permanent condition, but the discipline that it takes to get rid of it does not stay usually within the candidates that were seen in this study. So this is something to take note of. Now, if the question is, can type 2 diabetes be reversed, then we need to know what actually it means for type 2 diabetes to go into remission. The way that they check this is by actually checking the A1C. Is the A1C back in normal levels, and are you off of the medications that lower your blood sugar? If you are off of medication, and if your A1C is back to normal levels, then by definition, you have reversed the type 2 diabetes. But if you are someone that's still on medication, even if your A1C is back to normal, then technically you still have the disease because your body is still relying on the medication to keep it low, which means that there's something still going on in the body. But going back to normal means that your body is no longer relying on the medication that is used to lower your blood sugar or bring your A1C down to normal levels. You need both the A1C to go back to normal levels and your body to no longer be relying on the medication as well. Let's understand type 2 diabetes very simply. Think of type 2 diabetes as a clogged engine. If you remove the fat, you're basically removing the things that's clogging the engine. But also, if you exercise, you're making your engine stronger, and while diet is actually giving you the proper fuel for the engine to run properly. But without if you're missing even one of these, the engine does not function properly. If you increase the engine function by exercising, but you still have a lot of the fat, then there's still that clog that's there. Even though the engine is stronger, the clog is still there. Now, if you're putting the wrong fuel inside of a strong engine, even if there's no clog, the clog will come because the fuel or the food that you're eating is still bad. You need all three of these, and you need to be consistent with discipline. Now, having friends and family can help. Having a proper exercise and nutrition can help. Exercising all can help, but you need to be very, very serious about your commitment into reversing type 2 diabetes. If you just try it for a couple days or for a couple weeks, you will not see any significant changes in order to reverse the type 2 diabetes. If you do it for at least a couple months, 3 months minimum, over and over, consistently checking in yourself, continually monitoring the food that you're eating, continually making sure you're getting enough exercise and making sure that you're losing fat, then you are giving yourself the best chance to fight against type 2 diabetes and for it to go to remission so you can live a comfortable, normal, healthy lifestyle without having to rely on meds or constant doctor visits. If you don't take away anything else from this video, the main thing you need to understand is the first thing: type 2 diabetes can be reversed. Second thing, it requires serious dedication. The last thing is that it requires serious commitment. If you're missing any of these, then you will never reverse type 2 diabetes. But if you can be someone that is very consistent, if you can be someone that is very serious, if you can be someone that understands that there is actually hope for you to reverse type 2 diabetes, then you can be one of the few. You can be one of the people that actually change your life through making it better. Now, of course, when it comes to this, focus on the things that you can control. Yes, you may never be in a lab experiment to where the primary focus is reversing type 2 diabetes, but focus on what you can control, meaning you can control the food that you eat. You can control the amount of food that you eat, like the quality of the food you eat. You can also control how much exercise you're getting and how much sleep you're getting as well. These things are within your control. And even if you can't afford a trainer or a coach, focus on what you can do. And if you can do that over and over and over with the support of friends and family, then you will be on the right track.